Welcome to the 20th anniversary of the Arizona House Start program. The House Start program is one of the oldest home visiting programs in Arizona. It is based on the roots of the early work that began in 1998 through the Un Comienzo Sano program through the U of A Rural Health Office. The program addressed the need to promote access to prenatal care to improve birth outcomes. During the 1994 ninth special session of the Arizona State Legislature, the Arizona Children's Families and Stabilities Act was enacted, which created the House Start program at the Arizona Department of Health Services. Boy, have things changed since then.
Well, it's really hard to believe that it's been 20 years. And the only way I can really accept that is to look at my kids, because my youngest was an infant when I started with Health Start, and now she's a junior in college. So when I was hired and started with Health Start, it was a very, very tiny program called Un Comienzo Sano, which was a mainly Hispanic home visiting program, and there were sites in Yuma, Pinal County, and a few other places. And then we slowly transitioned into what we have now. The funding for the program had been just a little bit of money from MCH block grant, and then a grant from the NAEYC, the National Association for Education of Young Children. And it was that grant money that initiated the home visiting after the baby's birth.
There are many reasons why people become community health workers. Here are a few.
I became a community health worker because I wanted to make a change and I wanted to be a part of the community.
I think I've loved to help people all my life. And when I heard about this job, about becoming a community health worker, and it was to help people, it was like, a dream come true, because it comes natural to me.
Well, I became a community health worker because I've always wanted to contribute to my surrounding community in a positive way. And Health Start certainly makes that possible for my coworkers and I.
Community health workers are constantly witnessing the positive changes that many clients undergo while in our program.
Some of them kind of don't know where to start, especially new mothers. And just to help them, refer them to education, like getting their GED or finishing high school, because some of our clients are very young. You can see the growth in them from beginning to end, definitely.
It's really good to see a mother who has absolutely no family support here, has no loved ones, lives by herself, and is really trying hard to become very self-sufficient.
I've seen over time they become comfortable with me and they open up and are more willing to ask questions on their own.
Well, they grow in the sense that they're able now to get their own resources if they need. They don't need us so much. We try to teach them how to get out there, how to find resources. And so by the time they graduate, now they're able to go out there and get their own resources. Say, okay, they need help with their child might not have their immunizations. Okay, they might not have access, so they know where to go apply for access. They know where to go get their child's immunizations, and they have more confidence in themselves that they're able to do things for themselves more than what they used to when they barely started.
Along with the positive changes our clients experience, there are substantial rewards for the community health workers.
It's been working with women in the community who need the help, seeing where they're at, and then seeing where they're at, when they first come into the program, and seeing where they're at when they complete the program, seeing them going on to the next stepping stone in their lives.
Helping my low-income clients. A lot of them can't buy car seats. That's one thing I'm blessed that Native Health and Health Start provided us with the certificate to distribute out car seats.
The most rewarding part for me is actually being able to see and witness the healthy development of our beautiful babies in the program.
The most rewarding part is to see the women grow and see the women do better for themselves and have a better, outcome in their life.
After 20 successful years of serving women, children, and families in Arizona, the Health Start program is evolving to meet the needs of future generations.
Having more locations and more community health workers, that would help a lot too.
Maybe have more Health Start workers.
If they can't get a hold of us, they try to get a hold of us through social media. And I think that is wonderful. I really do, and I think that would be something. I mean, I don't know how we would start it or work with it, but maybe get like our own Health Start Facebook page would be awesome.
On behalf of the Health Start program, we would like to thank everyone involved in the early development of the program. All the partners, contractors, Health Start coordinators, and community health workers across the state for all their hard work, dedication, and commitment to the health and wellness of women, children, and families.
To this day, I have very fond memories of my time with Health Start. I'm very, very happy that I was able to participate in the development of the program.